everyone, I'm Todd Keats, founder CEO of My Care Friends, and Katie is our Vice President of Programming and Community. And we are here today with Cindy Koch, who is founder of Aging at 5280 in Denver. And the reason we're here is to do a webinar as part of the USC collaborative program with My Care Friends. It's a research program that you can find online, and we will send you the link along with this video. So hi, Katie, and welcome, Cindy. Thanks so much for being here today.
Thank you for having me.
And Katie, I'm going to pass it over to you to lead us along the way today.
Great. Thanks so much, Todd. And thanks so much for being here again, Cindy. We'd love to talk about advocating for health, your own health. I know you speak a lot about how important that is in terms of ensuring a vibrant and fulfilling life as you age. And addressing health concerns early is really important. And oftentimes people are not doing that.
Yeah.
So one of the things I'd love to kick us off with is why advocacy matters in aging. I'd love to hear from you and perhaps start with a real story that someone has you've worked with that's experienced the overwhelmingness of the system that we're in.
Well, I'm just going to start with myself going through this last thing with this detached retina. I mean, I am an advocate for everybody. I've been doing this work now for 13 years, and I can be a very strong advocate for other people. For myself, going through this, I had to have emergency surgery. I was in Dominican Republic. I had to fly home and had to have emergency surgery. Well, after the surgery, they really don't put you out. You're kind of knocked out. So my husband was my responsible adult. So he was kind of advocating for me, but I was kind of tongue-tied laying there, after surgery. And then the next day of how to really go advocate for myself. So then I'm like, okay, I'm just going to pretend I'm advocating for somebody else. And then I could go do it. And I think I don't know what it is, but it's just in our society, doctors, the healthcare system is just intimidating. And it is so important to advocate for yourself. And if you cannot advocate for yourself, find somebody who can help you advocate for you. So like I'm an advocate for all my clients. So, elder care managers, navigators, social workers, it's trying to find those resources is very difficult. But I can put people in touch with different people for that. But advocating is so important because the surgeon is looking at, well, for me, he was looking at my eye. He didn't really care if I still had to work, didn't care if I had to drive, didn't care if I was on other medications, really. He said, here's the medication. I mean, I couldn't drive after the surgery. So if I didn't have somebody, I would have had to have someone, go pick up my prescriptions for me. So that's why we were sharing, I think one of the biggest things that we need to start doing is putting care teams together around our beings, and who does that mean that's in that care being or that care team? So it's just, is it my two adult children? Is it my friend who's very close to me? Is it, I don't know, someone, my spouse, which is sometimes difficult to be on your care team because you kind of come at each other, and be okay with the fact that we need a break from each other.
Yeah,
it is very interesting when I advocate for other people and now I can't advocate for myself.
Mm-hmm.
Yeah, it's really particularly important for caregivers because caregivers, as one, we often, and that's who we're speaking with right now. We're speaking to caregivers, and as caregiver, just like we were talking before we started recording this, is I'm so focused on who I'm caring for that I'm not focused on me. And
absolutely,
that is ongoing. So your points are really important, that the caregiver needs to do the same thing in many ways that they are doing for their loved ones or the person that they are caring for, is set up that team. Who is your team that when you need it, you can go to? Because to your point, once you're in it, it's really hard to set that team up.
Oh, absolutely. Yeah.
You need to be able to just make a call and let that person or people get going. Otherwise, you're not going to have the care that you need.
Yeah. And so since I've started doing this, on the sheet of paper that I have like companion, who's going to be a companion, who's going to take you to the doctor's appointments, who's going to go pick up your meds, who's going to deal with technology. All these things we don't even think about that we need, and slotting somebody in there so when something goes haywire as a caregiver, say that you can't make it to go to pick them up for the appointment, you have someone else on there who knows what the doctors are, what the needs are. And I know this is takes work to do this, but I'm telling you, once we get it into place, we just have to revisit it as we age. But so that's what my new approach is putting care teams together.
Yeah, and I'm gonna another piece. I'm knee deep. Well, not knee deep. I'm neck deep in this.
Yeah, you are.
Um, the role of advocacy is about improving outcomes. It's about reducing stress and dignity, and it's promoting dignity for ourselves if we're the ones setting this up. So it's really important to set it up beforehand. So these networks, because it's going to improve the outcomes. Because if you think about it, if you're in the hospital, it's an emergency. Trust me, that's not what you're focused on. You are focused on all the healthcare folks, the professionals coming at you. What do you need to have done? And so if we have that set up before, that can not just improve the outcomes, but hand in hand, first, it reduces your stress.
Absolutely.
You're stressed in there. It's proven over and over, scientifically, anecdotally, everything, that the less stress, the better we are.
Right. And so just like our trust, if you do a trust or you do a will, those things need to be pulled out also every 5 or 6 years because life changes and people don't do that either. So it's a trust or a will that you want in place, all your documents, and then a care plan and a medical team that you want to have in place. And I think everyone pretty much has the medical team, even though they don't realize that, they have all their players, but do you have them knowing each other that they work with one another? Like for vision, right? So vision is a big thing to detect diabetes. And that's I've seen big research out lately about ophthalmologists wanting to know who your primary is so they can get the information over to them about what's happening with your eyes. Obviously, I'm focused on my eyes right now, but I think that's a really, but you need to be that advocate to make sure they're all talking to each other or have an advocate to make sure they're all talking. So medical team, care team.
Yeah. There's another part of this. I'm going to kind of bring it together, and there's what we'll say 5 key pillars, key areas. One being, which we're talking about, know your health history. So that's number one, and we'll break down a little bit further in a moment. Build your healthcare team, which is what you're talking about, Cindy. You need to ask questions and speak up. Be that 2-3-year-old that's always asking why.
That's right.
You got to keep asking. I know we want to respect the professionals, the healthcare, the clinicians, and that's important, but they're humans too. They've got 15 minutes to see you, and they've got a lot of things pulling at them. So we have the right, as a patient bill of rights, to ask why. I don't understand. Please explain. We need to plan ahead, which is what we're talking about, and then leveraging resources. And resources like Aging at 5280 and other organizations that can be helpful. So, Katie, you want to talk a little bit about some of these and break them down?
That's great. I'd love to hear after we talk a bit about this, Cindy, how, from your perspective, how to leverage the expertise of elder care managers, because it's as I'm hearing you talk, it's humbling. It's easy for us as experts within the field to share what is right and what's best to do. But when we actually go through that, as I'm hearing you speak, it's hard to take our own advice.
Absolutely.
So how, as I'm thinking and sitting in my seat right now, how do we leverage the expertise of elder care managers of our healthcare team? And I know your area is in the elderly care managing world. So I don't know if that's talked about so often in terms of like, what does that look like? What do we look for and so on? Could you speak to that?
So here's my dream is that everyone, when they turn 65 and go on Medicare, they are given an elder care manager, such as myself or a navigator, so that I can sit down for an hour and a half with you to tell you what your care journey is going to look like. So it means, okay, if you're going to stay home, these are the things you need to do. If you're going to move to community, this is what you need to do. This is how much money you need to have because people do not plan, we plan for retirement, but not for aging.
Right.
So working with somebody like myself, we can help you figure out everything from A to Z and all the financial piece on it. If you have no money, help you with the Medicaid piece of it, help you with aid and attendance if you're a veteran, help you, figure out where to pull the money from first when you need care, because, sometimes people will take it from an account that has has a penalty on it. Well,
Right.
wrong bucket of money to take it from, and I see that all the time. So we can help, figure out what's the best way to pay for these services, long-term care, obviously, too. We can help open up those policies. So working with anybody that is a third party is I think it helps so much for this whole
Yeah.
process because, it's so hard to be the adult child and trying to tell your parents what to do. They
Yep.
don't like to be parented by the adult child.
Right.
And the adult child kind of gets cranky. My mother on her deathbed said, you are so sweet. You are so cranky sweet.
I, I want to jump in for a second because there's also a group that may be listening now, and that is becoming larger. I've been seeing more and more articles about it over the past year or two, which are people like myself who aren't married and don't have kids.
Yes, solo agers.
And so
Yep.
those solo agers, it's even more important because you
Yes,
don't have anybody that by willing or guilt is going to come and take care of you.
Right.
I know.
Very important.
So now there's a solo ager day. It was May 14th or something, because 20% of the baby boomers are solo agers, and a majority of them are women. So and that's another thing, right? Because you are well, you're an only person. You're going to be solo aging, Todd.
I'm solo aging.
Well, you've got Katie not here.
I was going to take care of you.
But it's true. So solo agers is another whole thing, and travel, and living quality of life being a solo ager. There's
Right.
all sorts of different things happening on that piece of it too. So it's yeah. So but yeah, working with elder care, anybody, a third party, I think, who really listens and really understands how to bring resources to the table. Like when you go in, and I just experienced this with my eye, they did not send me home with many resources. If I needed a driver, they didn't say, here's a driver who can, because I can't drive right now. They didn't say, do you need a driver? Obviously they knew my husband was there, but they don't know what he does, so a driver, do you need to go to work? What does work look like for you? None of these questions were, I'm now 3 weeks out. And if I would have had to go work in a machine shop or something heavy lifting, I couldn't have done the work.
Right, right.
He
Yeah.
didn't even ask me what I did.
Exactly. They don't ask that. And another point to add to this is something that folks like you do as well, which is really important, is you're helping them not just navigate, this is what I have to, this is what I should do, this is where you need to look for it. You're helping them also navigate the psychological, emotional components of it. That's a big part of it and very important.
Yeah.
Often caregivers or people who end up as caregivers, they don't know how to handle this. And if you're dealing with family, it can be that much more challenging because
Yeah.
you're dealing with a lot of unresolved stuff that's been there for decades and it's going to come out. So somebody like yourself can really be helpful in that.
Yeah.
Well,
And
I know. Yeah. So like I just yesterday I met with someone and she would never talk to her care about or would talk about what she needed for care. Well, once I met with her, now said, I need overnight care. I don't feel comfortable. I need a walker. I need a walker. And she was not walking on a walker. She will use a wheelchair when she goes out. All those things were not happening before I met with her. And now she'll be safer, more quality of life, because now she'll have care overnight, which I'm going to open up her long-term care so she can get this care overnight. And she's 93. She's got a 4-year policy. And not tangent here, but those long-term care policies, if they're not open and used, they go away. Nobody gets the funds.
yeah.
Huge advocate for long-term care opening and understanding policies.
Yeah, absolutely. And you can help people navigate through that. That's
Hmm.
what we're talking about offline, about what I've been dealing with this morning with related to my mom.
Mm.
And it's help understanding the policy, certainly first and foremost, but then there's the other part of how and when to use it. And
Yes.
that is
Yes.
a really important part to
It's a
understand.
very important part. And they, again, your insurance agent's not going to tell you how to utilize it. And
Nope.
there are strategies on how to utilize long-term care policies.
Yeah, one point to make to this is the caregiver, the advocate, the patient, is the client. So we find the people that, like yourself, Cindy, that we trust and we know that you're looking out in our best interests. If you're not suited with this person, find someone else. I think that that's something we don't talk about. It's oftentimes reverse, like, oh, I have to listen to this person. If you're feeling,
Right. And
same
that's the
with,
same way with doctors, right?
yes, I was
I
just
mean, and that this is what I say to, if you're going to bring in care, you want to make sure you always feel comfortable in your home. So
yes.
if you're bringing in care and someone is chatting too much or they're like not the type of person you want to be around for a couple hours, get somebody else in there. That is just part of what this care journey looks like. It's about quality of life for us and for whoever we're caring for, and just quality of life for human beings.
Yeah, absolutely.
And we're all gonna go through this journey.
Mhm.
Nobody, I mean, everyone goes through this journey.
One thing we all share.
Yeah.
Yeah.
Absolutely. Yeah. Uh, so in terms of resources, Cindy, other than folks like yourself,
Yeah.
which are wonderful, what other resources should caregivers consider in helping them on their journey?
So, so if you're going to stay at home, make sure you have all the tools at home. So if you need like a bedside commode, a higher toilet, make sure all those throw rugs are picked up off the ground. You want to look for different tools for staying at home. The life alert, right? This gal I met with yesterday, if she fell, no one would find her. So I got her a life alert. So different things like that. So on my website, I have tons of resources, so you can find all these different things. And then if you're going to move into community, have someone like myself help you move into community, because we know everybody in our market. We know who's doing a good job. We know the owners. We know what it looks like to transition from your home of 40 years to now a much smaller, apartment, and how to make that transition, smooth and comfortable for you. And then we follow up, after that, making sure that you have moved into the community and you've adapted and gotten to know people and know all the people who work there. And then the next step is, if you or have a chronic disease, palliative care, then hospice, then transition.
Mm.
So all those, it's a journey like that.
So for people who are not in the Denver area or in Colorado, they can call you. From a practical standpoint, what do they need to search for if they're doing a search, and are there certain things they need to look for when they are talking to those people after they have done the search?
If they're working with an elder care manager in a different city.
Exactly.
Yeah. So you want to make sure that they work with everybody in the market. So a lot of people do not work with all the different, entities in the market. How long have they been in the market? And interview people. Like you said, Katie, if you don't like me and you don't feel comfortable sharing with me, find somebody else, because this is a human being business. We are human beings doing this servicing, this servant care. And you want to find someone who you're really comfortable with. So you want to make sure that you're comfortable with them, make sure that they've got some years of service, that they work with all the different services in the market. And you can find that out when you ask, hey, what non-medical home care would you advise? And they say, I don't really work with anybody. Nope. You need to work with people who have vendors and vendor vetted relationships. And that's what, we have. I mean, people can reach out to me because I'm part of the National Placement and Referral Alliance, which is a
Mm.
trade association we started to create best practices and code of ethics in this business. So we are now pretty much across the nation. So there's a lot of networking amongst us now, which is terrific because there wasn't even 5 years ago. So now there's a lot of collaboration across the whole United States. So I can find people everywhere.
That's
Which is
awesome.
awesome.
Yes, that is awesome. So we are up against our time.
Yes.
Is there any final parting messages that Katie or Cindy that you have before we say goodbye?
I would just say, um, I was just had to be an advocate for myself, and I even had fear around it. And be okay with the fact that you may have fear when you do want to ask these questions, but know that it's going to be more of a challenge in the future if you don't do it now. And here's what I want to take away. Write down what you want to talk to your primary about every time. So if you're going to go talk to your primary and it's, now your foot's feeling funky or you've got a headache all the time, make sure you just always write things down about your care and then take that list to the doctor with you
Yeah.
so that you can advocate for what you need. Because when you sit there and they talk to you in that 15 minutes that Medicare gives us, it's just too quick.
Yep. Yep.
Agreed.
I'd say to piggyback on that, if you get an answer in response to your question and you still don't understand, it's okay to say, I don't understand. Can you please
Yes.
explain?
I don't understand. Can you please explain? That's
Yep.
very good language.
Yep.
Yeah, we can go on and on about this which I think we should, language around talking to long-term care. How does you speak to them? The language around healthcare is a huge thing.
Absolutely. And we could definitely talk, we could do an hour or two, we could do a day of how to deal with all
Part two.
we talked about. But
Yes.
in the meantime, in lieu of that, folks who are listening, thank you so much for being a part of the study with University of Southern California, My Care Friends. Cindy, thank you so much for being here.
Yeah.
Katie, as always, thank you for partnering with me on all of this.
Absolutely.
And you can visit Aging at 5280, Cindy's website, download the information that's there. And you can certainly reach out to her. You can reach out to Katie or myself at any time. We're happy to get into more detail about anything we've talked about today. So
Absolutely.
again, thank you so much. And most importantly, take care and be well.
Thank you.